Hi, everyone. My name is Victoria. I'm the Program Assistant for the Health Leadership Advanced Certificate, and it is my pleasure to welcome you to this information session for the Health Leadership Program. We're happy to see you all here today, and we thank you for attending. As we go along, feel free to post any questions or comments that you may have into the chat during the presentation, and we'll do our best to address as many questions as we can during the Q&A segment at the end of the presentation. And before we get started, I wanted to say that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. And now I'd like to call up Shan Sataglo, the program head, to introduce the department and speak about the Health Leadership Program.
Hi, everyone. It's Shan Sataglo here. I recognize some names. I think I've been on email with some of you in the last couple of months. Thank you very much for joining the session today. So, like I said, my name is Shan Sataglo. I'm the program head of the Healthcare Management Department at BCIT. And my role is to oversee the Healthcare Management Program, run the program, as well as I serve on several committees in our school. I'm the chair of the research committee and a committee involved with workplace wellness for faculty and students. And I've been at BCIT for 20 years. So the role of our department in our school and at BCIT is we inspire and educate health leaders who wish to develop their leadership and management skills to contribute to a positive change in the health system. And for today, this is the format of this session. This is specifically designed to engage people who have working healthcare experience. So for that reason, we'll have a bit of a kind of a semi-anonymous roundtable introduction where we could share a little bit about ourselves through the chat tool. And then I'll be presenting for about 20 minutes. And as best as I can, we're going to keep around 10 minutes or maybe more than 10 minutes towards the end to do some Q&A. Like I said, because the program is designed for working health professionals, having the chance to hear from others in terms of motivations for being interested in a program like this is always very helpful to kind of make sense of the way we approach education and our careers. So that's the format for today. So to get started, I'd like to invite each of you to submit just one post into the chat tool. You'll see the chat icon near the bottom of your Zoom screen. And without disclosing more than you might like, just indicate your role, your academic background, and where you're located, where you're dialing in from. So I'll do the same, and you can kind of read my information there as well as each other's. So please, let's take 5 minutes and just submit a chat to do a bit of sharing. Just looking at the range of backgrounds, it's very, very interesting. And as we go through the presentation, I'll be speaking towards kind of how healthcare occupations are changing, as well as the needs for diverse perspectives for supporting change in healthcare. So thank you for sharing. Now I'll proceed with the presentation. This is our belief in the Healthcare Management Department at BCIT about healthcare and the future of healthcare. We believe that the future of the Canadian healthcare system will be more patient and family-centered, more focused on prevention, community-based care, more on accountability and involving interprofessional teams, and also serving an older demographic in the population. So one of the critical questions is, especially if you come from a healthcare clinical background, who are going to be the clinical and non-clinical leaders in the future of the healthcare system, and how can we as professionals and occupations in the system contribute to a dynamic and thriving system into the future. In Canada, we often feel much pride in our Canadian system. Oftentimes it's due to comparing ourselves with our neighbors to the south. But on a global scale, Canada is not really at the top of the scale. This is a report from the Commonwealth Fund. Every few years, they update this. It's a global comparison of Canada and other highly developed countries. And you can see on this ranking, the areas that are circled in red for Canada. We've got like a number 10 out of 11, a number 9, a 10, and 9. So there are quite a few areas where we're really not ranked at the top, and the Northern European countries tend to do pretty well. So it's a bit of a reminder to us in Canada that we can certainly do better. And by comparison on a global ranking scale, it certainly indicates that there's opportunity to improve. Similarly, looking at performance of various health systems compared to spending of health systems, Canada certainly has room to improve. And if we drill down to the provincial level, and this is in British Columbia, many of these issues will have some commonalities to other provinces throughout Canada. But in BC, you can often get a sense of where the priorities are based on the sequence of the goals that are indicated in services plans and how much attention is being addressed to each goal and sub-goal. So for example, in British Columbia, if we look at our Ministry of Health services plan that goes out to the 24-25 fiscal year, 3 goals are identified in ensuring a focus on service delivery areas that require repositioning. This relates to shifting of care from purely the acute dimension to community areas throughout British Columbia. Goal number 2, supporting the health and well-being of members of the province through high quality services. And then goal number 3, focusing on sustainability in public health care. If you look at the sub-goals in these areas, these topics, primary care model that needs improvement, more team-based care, seniors, issues around mental health and substance abuse, wait lines, timely access, population health, looking at purchasing of supplies and equipment, bringing back some production capabilities into the country as compared to outsourcing it to other countries, focusing on actually a sustainable healthcare workforce and using all the capacity that we have in delivering healthcare to actually learn about healthcare and how to improve and to support innovation and the economy. So these are some very high level priorities, important themes of how healthcare needs to change in the province of British Columbia, and nationally and in other provinces, there will be some commonalities as well. So oftentimes when we see something in the news that is disappointing or really something that needs to change, it's quite common and popular to point fingers. And it's a bit of a catch-all phrase, but the suggestion is, well, we just need better leadership. Leadership is kind of a nebulous topic. And if you talk to others, colleagues about the role of leadership, there are all sorts of definitions. It's almost like this phrase from Warren Bennis, who's a thought leader in thinking around the theory of leadership from a US-based organizational behavior perspective. Dr. Bennis says leadership is like the abominable snowman whose footprints are everywhere but is nowhere to be seen. So kind of a tongue-in-cheek critique about the way we discuss leadership. If you go to Amazon.com or Google and look up the word leadership and look at the texts that are available, there are just so many ways of looking at the subject, from leadership that matters, strength-based leadership, leaders on leadership, leadership principles from Attila the Hun, or servant leadership, scorecard for leadership, critical perspectives on leadership, and so on and so forth. So it's a vast, complex space. And if you reflect back onto your own discussions at work with colleagues or reading the literature that is in your organization, you'll see there's quite a lot of variation in these terms and even how they've changed over the years. Here's one that I like. Leadership is accepting responsibility for enabling others to achieve a shared purpose in the face of uncertainty. So one of the first exercises that is actually done in our program at BCIT is developing a personal, customized understanding of leadership that relates to where we are at this point in our career and with the challenges that we see in front of us. It's a very personal exercise. So situating the health leadership program in BCIT and in our location in the School of Health Sciences, health leadership is actually the 5th program that we've been running through our department going back the last 20, 30 years. You can see on this timeline going way back, at one point, we actually hosted weekend and evening courses, night courses on healthcare management, a level 1 and level 2 program. In around 2000, we launched a suite of programming because e-learning was the new technology at that time. We ran a program on clinical trials, administration, informatics, quality improvement. And in the last decade, our flagship program has been the Health Leadership Advanced Certificate. And this program contains kind of a consolidated essential learning about leadership in healthcare. If we look at the students who are currently in the program, this is a pie chart just illustrating the distribution of people, where their backgrounds are academically, and their proportion in the program. So you can see on this pie chart on the left side, we have people from a health sciences technology background, about half, and then dividing those into their components, people with diploma-trained backgrounds and people with baccalaureate training backgrounds. And on the top right of the pie chart, you can see that we've got quite a significant component from the nursing profession, including both baccalaureate trained nurses and specialty nursing. Then we have people from a variety of health sciences and arts backgrounds in health sciences. Many of these come from Simon Fraser University, which is one of the provincially funded post-secondary institutions in BC. And then we have some niche areas, a variety of people with master's trained backgrounds, master's in public health, nurse practitioner, arts in science, various sciences areas. And then we have a number from other areas, often from different sectors who are kind of transferable knowledge into healthcare. And then in terms of the disciplines where people come from, you can see here on this list, the disciplines that are in blue. These are actually alumni of BCIT Health Sciences. So people who graduate from clinical genetics, sonography, radiation therapy, biomedical engineering, nursing, and so on. And as well, we have disciplines who are not really alumni at BCIT, but they are health professions and occupations in the province. And many of these people got their training from other institutions like UBC, SFU, the University of Victoria, and others. So areas like medicine, certainly pharmacy, respiratory therapy, physiotherapy, and so on and so forth. So our program is really quite special in the school and at BCIT, and that it does focus on working health professionals. And so that permits a really great learning community of people from across disciplines in healthcare. In terms of ages, age groups, people are kind of in the first half of their career, around 37-ish, plus or minus 7 years. That's kind of the majority of our students in the program. So in terms of your career in health sciences and the health professions, what I've tried to illustrate here is that learning is no longer you do your first credential and then you're in the field and then you just continue to work there forever. It's kind of a stepwise incremental approach. After people finish their first credential in post-secondary, it takes 2 to 6 years. They get into the workplace after that. There's a bit of churn, some complexity of just kind of getting life somewhat settled, emerging as a professional, and then realizing, okay, so how do I get to the next stage in my career and realize the potential I have in myself and in my work. So actually, the longer portion of a person's career is all that realizing potential and growing lifelong learning throughout one's career. So likewise, probably similarly to academic development, people also go through different stages of development as adults. And so the way they interact with the world, the commitments they have, the complexities that they deal with evolve over time as well. So in terms of careers, just one more comparison before we move on. Back in the day, people followed more of a linear path. You kind of learn your field, you get more expert in your field, and you progress like that. Nowadays, there's a lot of lateral moves, people changing between provinces, changing from a clinical role to an administrative role, people changing within their organization or into different organizations, sometimes even crossing to other aspects of a sector. So say, for example, going from a clinical role to working with a vendor, working in consulting, and then maybe coming back into clinical as a director level. So a lot of more variation these days in healthcare careers. So that is why we have the health certificate, the advanced certificate in health leadership at BCIT. The program is designed, as I mentioned before, for working health professionals. It's comprised of 8 courses that spread over 2 years, and the level of study is upper baccalaureate level, kind of inching our way into master's level of study. The program is anchored by the Leads in the Caring Environment framework, which is a competency profile for health leaders in Canada. After completing 4 courses in the program, 4 out of 8, we celebrate by sending you a statement of completion, which acknowledges that you've made it to the halfway point. And then after completing 8 courses in the Capstone project, you're awarded the BCIT Advanced Certificate in Health Leadership. To get into the program, the minimum entrance requirements is a health sciences diploma or a degree in any other field with transferable skills into healthcare and English language proficiency. One thing that's really important for success in the program is to have relevant work experience, usually after having 2 to 3 years of significant experience in healthcare, so that you can really link the learning to your work that you're encountering in the day-to-day, as well as being able to bring experiences from work into your learning experience in class. So it's really important to be gainfully employed in a relevant area of health services or a similar sector, and having kind of enough discretionary self-sufficiency at work that you can link your learning to your work. And that emerges with people at various points of their career. In terms of the courses, like I said, there are 8 courses in the program, and there are 3 special courses that you can see with an asterisk beside them. The 3 courses are available for people who are not in the program, and they're also available to people as electives who are in other programs at BCIT, and I'll speak on more of that later. So in the first year, the subjects are for emerging health leaders, healthcare policy, human resources, labor relations for leading health professions, and sustainability from a financial perspective in healthcare. The second year looks at performance management and measurements, evidence-informed decision-making for health services management, project leadership, and then the Capstone integrative course. The kind of learning that people do in the program, it's on a sliding scale from independent work that you do yourself right up to highly collaborative group projects. And these are organized throughout the program in a way that you don't do all your group work 100% at the beginning. It kind of builds up over time, but we do strike a good, healthy balance between individual work that you can be fully accountable for and control, to group projects where some of your success is going to depend on how you work with classmates and others. The Leadership Integrated project is the highlight of the program. It is the capstone course that comes at the end of the program, where you work with an organizational or executive sponsor to address a problem in the workplace that deserves careful attention using evidence-informed decision-making. So the roles include the student who leads the project, the academic facilitator who provides support, and then the sponsor who is an authentic client for your work in your organization. In this project, there's also a fourth optional participant, and this is really up to the student and the sponsor if they would like to involve a subject matter expert from industry, or even one of my colleagues, a BCIT faculty, maybe a patient voice into the project to be a part of the discussions that occur for the project. So I'll speak more about the project later if people have questions about this, but this is really a highlight of the program. I would say it is an excellent way to demonstrate and integrate the learning that you've gained from the program with a sponsor who's really interested in seeing what you can do with a problem or an opportunity that's of importance to an organization. In terms of the topics and the domain areas that are often done for the integrated project, oftentimes the domain areas relate to the people's, the students' professions that they come from. So focusing on some issues in medical laboratory, pre-analytic errors are always an issue. Focusing on long-term care, this is another challenging area, medical imaging, mental health pharmacy, nursing. And then in terms of the techniques or the applications that are focused on, quite often they relate to these subjects you hear on the right. So for example, integrating patient voice into quality processes, looking at organizational change, reconfiguration of programs, program evaluation, workflow is really important. Healthy workforce is another important issue. Some sectors like medical laboratory involve quite a lot of demographic change and shortages. So focusing on onboarding and training, these are all really important topics that are often addressed in the integrated project. And here are some of the topics that people have done. So for example, there's quite a few of these. Recently, there was a project done at PHSA looking at how to spread and scale the learning from quality improvement, working with physicians in British Columbia. On the left, there's some projects here related to lean and quality improvement in the medical laboratory space. We've had a project on the bottom left, this one about medication award stock contingency. This is actually related to standardizing the inventories for drugs in the mental health and substance abuse areas and corrections. So very much of a different sort of organizational context that required bringing a pharmacy perspective for quality and safety. So it can go on, but you can see from the variety of topics that they're all fairly nuanced, and they quite very much relate to the profession and the experience that people have, coupled with the learning from the program and the role of their sponsor. So in terms of the faculty in the program, there's full-time faculty and sessional instructors from the health system. People have director level and senior leadership roles in the health system, particularly the sessional faculty, master's trained and above with various professional qualifications and diverse experiences. We have endorsements from the Canadian College of Health Leaders and Emerging Health Leaders. And within BCIT, I had mentioned before elective courses. Some of our courses are used in a variety of programs in BCIT. So the Bachelor of Health Sciences in Medical, in MRI, the new Digital Health Program, the Data Analytics Program in Computing, the Technology Management Program, and Project Management. So being a very focused and relatively short program on health leadership, some of the courses that we have are accessible to other parts of BCIT. In addition, we have information sharing relationships with emerging health leaders and Will Rhodes University. For the department, this is our annual course schedule. We run our program and our courses on a very regular basis. So you can see here, hypothetically, let's say you started the program in January of this year, the suggestion would be that you would take in 2023 in January 2 courses, 7110 and 7120, do those concurrently. And then in April, you would do 7130. In September, you do 7140. I'm tracing the orange line here. In January of next year, you would do 2 courses concurrently, and then another course, and then the Capstone course 8280 in September of 2024. So you can see how the timing of the courses is organized around a January start date. But then you could also see that there are these other boxes, these other cells here called additional, and there are these multiple layers of students coming into the program. So this is done on purpose so that if you do have to take time off, or you wanted to study more quickly than the normal schedule, you can actually pick up courses from these other streams to compress your schedule or to lengthen the schedule as needed. So there's quite a bit of flexibility, but by design, the more optimal schedule is a January start date. In terms of the cost of the program, the total amount is just under $8,000, $7,973. The tuition is standardized for the courses. It's $903. There's a variety of nominal additional fees, like the student services fee. If you have textbooks from BCIT, there's a shipping cost for that, and so on. And you can also see that the first course in the program, 7110, the texts are higher because it includes a reference text for the leads in the Caring Environment Framework and some other materials. And for some of the courses, there's actually no text fee. Oftentimes we try to make use of open source resources as well. Courses have quite a lot of internal resources inside them, drawing from professional and peer-reviewed literature and selected other materials. In terms of costing the program, comparing to other programs in British Columbia and beyond, if you think back to your undergraduate credential, that would be represented on the bottom left corner of this diagram. So your kind of general education or entry to practice into your field, oftentimes the tuition that you had paid in those days was highly subsidized by the province. And that's because everyone needs a chance to kind of get through a post-secondary education and get into work. But later in life, when you are in the workforce, the tuition is usually paid through the student themselves. And so that is the price point where the advanced certificate in health leadership is in terms of the price point. And then there are a number of programs that you can access in your province and beyond that really focus on master's degree programs or executive level programs like EMBA programs, the MA in leadership, and so on. These are programs that are often supported through one's employer, so corporate sponsored. And those tuitions, because they are fairly exclusive, is 2.5 to 3 times the tuition for the mid-range. So our focus at BCIT is to be really highly accessible, not to be exclusive in terms of the positioning of the program, but to be something that could really contribute to a dynamic, distributed leadership in the health system. And for that reason, we've kind of positioned our program kind of that accessible midpoint. So we know that there are some people who already immediately know that they want to get into the program and finish in 2 years. And there are some people who need a few courses, maybe not for sure committed to a program. So we describe this as people who are accepted to the program. And in that case, they need to formally apply and get into the program. And people who are kind of taking courses a la carte, so taking 1 or 2 courses as an undeclared major. So if you're planning to be in the program, our expectations for your progression, we divide this into 4 milestones. So first, if you get into the program, don't get into the program and then just don't start. It's really important to take your first course within the first 6 months of being in the program, just so that you have momentum and psychologically you feel the satisfaction of making progress. Aim to complete the first 4 courses in the first year. And then at that point, start thinking about what to focus on in your applied project. Talk to sponsors look at the proposal templates, talk to me at BCIT to identify a suitable project for the end of the program, complete the remaining 3 courses, and then do your capstone project. And then at that point, you're awarded the Health Leadership Advanced Certificate at the end of the program. And for those who are looking at a program like ours and maybe just interested in the project management course or the fundamentals for health leadership course, we suggest that, try to take a course every term. And if you're still not certain, to have a call with me, and maybe we can discuss if the program is the right thing for you, or maybe you can link the courses to some other plan of study that you have in mind. In terms of next steps, what can you do at this point? The admissions process for the program occurs all year around. It's highly digitized, so you can gather your documents and upload the materials into the course. This happens all throughout the year, although some points in the year are faster processing than others. Like Christmas, for example, it tends to slow down, and at other times it's really busy. So there are some delays there, and at other times it's fairly quick. BCIT also has a very well-developed program advising department. These are non-teaching faculty who can advise students on how to align their interests with the programs that are available at BCIT. As well, our department, Healthcare Management, we have an online request and assessment forum. This is an informal way of gaining feedback from me by sharing a bit of information on if the program would be well suited for you. And I could always add some other tips and suggestions in there. So to end off, I'd have a few kind of excerpts from students who have gone through the program. These were selected because they're kind of illustrative of the different types of people and also the situations that people encounter that relates to leadership in their field. So this person is talking about how great it is to be interacting with people from different backgrounds as part of their study, as compared to being caught up into one's own specialty, having been trained in a very niche area to begin with. This person provides technical expertise and leadership to quite a large team, being a lab tech for 12 years. This person, she's a nurse in Montreal. She is now at the point in her career where she's been preceptoring and mentoring quite a lot of new nurses and new students, and linking that to her role as an emerging health leader. This nuclear medicine technologist, interesting perspective, leading a department, but is actually the youngest in the department, which is an interesting challenge. This person is actually crossing from a non-clinical area into healthcare, and he's commenting on how it's really important for people who are in clinical roles to understand some operations. So, for example, finance, and for people who are in the finance or accounting world, we really need to understand workflow and the challenges of having organizations where it's highly dependent on human capital and work, and so on and so forth. So at this point, I think we've covered most of the presentation. I'd like to turn the floor back to you to see what questions you might have about the program. I'm happy to go backwards into slides and refer to some of these, and I could also turn off the slide share and maybe we can have a bit of discussion. So I'm wondering to hear from you if you have any questions at this point for me that I can help clarify. Were there any points that really jumped out at you as things that you wanted to learn more about? I also want to just remind everybody that we do have 2 of my other colleagues on the call. Victoria Denham, who's the program assistant in Healthcare Management Department. Victoria works closely with me. And Maninder, who's a program advisor in our advising department, whose role is to support students with kind of high-level inquiries around the programming at BCIT. Maybe I can ask Maninder, is there anything that you wanted to add at this point for people who are attending?
Hi, Shan. Thank you. Well, you're quite detailed. That was great information. So thank you for providing that. We're here to assist with this program, I would say mainly to give an understanding of if applicants who have some foreign credentials, if they're looking to find out whether they need to get assessments done, if they meet English requirements, or if they need to work on English requirements, what are their options? Those are some of the areas that we can assist with. Perhaps with students who maybe are starting their career in healthcare and wanting to sort of consider this in the future, but they're trying to figure out where to start, we can also assist with that as well. So those are some of the areas that we'd be able to provide assistance in.
Thank you, Manager. I can really relate to that and to the way you've helped us with our students over the years.
Thank you.
And Victoria, did you have anything that you wanted to add before we kind of receive questions from others? And you're on mute.
Not really. I just wanted to keeping an eye on any questions. Please, we like questions. So if you have any questions about your own path in the program, feel free to ask them in the chat or put your hand up. We'll unmute you. So
if people don't have questions, I have some that commonly come up.
Okay.
Okay.
So let's go to Shan's commonly asked questions.
Okay, I'll provide a few to get it started. One question that often comes up is workload. If you're working in a fairly heavy load in your day job, have other commitments, whether it be family, parents, other organizations, etc. Common question is, what is the workload in a program like ours at BCIT? And especially this collaborative teamwork stuff, like how do I make sure that it doesn't overwhelm my capacity to work in the program? So the answer is each course is a 3-credit course. And the common rule of thumb for a 3-credit course, basically in North America, is it requires around 7 to 9 hours of work per week in all areas. So if you think back to your undergraduate studies, let's say it was Psych 100 or Math 100, you would go sit in the lecture Monday, Wednesday, Friday for an hour. So that's 3 hours. And for every hour in class, you'd spend around 1 to 2 or 2 and a bit more preparation outside. So when you add all that up and multiply by 12 to 15 weeks, that's about the same workload as any one of our 3-credit courses. So the answer is the workload is around 9 hours or so per week, and it's kind of different depending on the people. So that's a way you can think about integrating it into your own schedule. With the 8 courses spread over 2 years, it's fairly manageable for a person who's working full-time. People would take 2 courses at once, and then in the other 2 courses would be one at a time. And that would be for the first year, and then they would basically do the same in the second year. For the question related to teamwork, I said before that at the beginning of the program, more work is done on your own. And then as you go through the program, you'll learn different ways of engaging with classmates, whether it be a seminar style discussion that you co-lead, or it could be a group case study. It could be a financial analysis in Google spreadsheet, for example, and then other models. So these vary through the program, and you get plenty of time to get used to working online with classmates.
Shan, we have one question in the chat. If I
Yes,
started this April, would I be taking 1 course to start? Is it possible to start this April if I complete the registration process?
Yeah, that's a great question. So yes, you can start this April. And I would suggest if you haven't done any courses related to health leadership before, I would say start with the first course, 7110. That's the fundamentals for health leaders. And that course actually runs 3 semesters per year. So it's running every semester. And if you take that in April and take another course in September, for example, you would have finished 2 courses. Another question that comes up is, if I take it in April, which cohort of the program am I associated with? Am I in the 2023 cohort finishing at the end of 2024, or would they bump me into 24 finishing in 2025? And that's something that you could specify when you apply to the program. I would suggest if you did a course in April 7110 and then did Canadian Health System in September, you could actually have knocked off 2 courses off the list of 8 and then commit to 2 years. You would have 6 remaining to do over 2 years, which is a very reasonable load. That's a great question. Thank you for asking that. There's another question. It might be too big with a smiley face. I'm just going to read this here. Interested creating roles policies that do not exist in the healthcare systems I work in. That's very much leadership. Hoping to provoke support system changes. Okay, status and so on. Formal recognition, teams that I work with. Okay, that's a challenging question. There's many dimensions to that, from advocacy to having a personal vision of leadership that gives you kind of a sense of direction to navigate through the uncertainties that are encountered. There's certainly an economic component to that, possibly as well, making business cases for change. So quite a few of these things, they would be addressed as part of the program. I would say the fundamentals for emerging health leaders can be very useful. The Canadian Health Policy course can be very useful. Project management can be useful in terms of designing interventions that are acceptable from a business perspective. So those are some ways to get started. If you're kind of in a place in your career or maybe with other commitments where you might not be absolutely sure if you could do a program in 2 years, you can take some courses a la carte as the undeclared major. And that's the first course, 7110, 7120, that's the Canadian Health System, and 7270. These are listed on our website. So those are some ways to try a little bit, see how it works, and use the learning in your career, and then use that also to help you decide if you want to commit to a program or not. Hey, another question came up from Peter. Just reading it here. Yeah, this is a pretty kind of administrative detailed question, and I think this is definitely something that we could address through email with you, Peter. Through our office in Healthcare Management Department, we can also work with BCIT to make sure that the start and the end dates to your program aligns with your expectation after discussing with us. So we actually have the ability to do program extensions. Say, for example, in the case of a person who had to deal with family issues overseas and they had to take 6 months off of studies, it kind of changes the feasibility of the program end date that they received. So we would often go to that part of BCIT, the registrar, petition for the student and make the change to the program end date. So we can kind of do quite a bit to manage the administrative aspect of a program. The most important thing is that when you're in studies and you have a career, it's actually pretty tough. It's not easy the way it might have been in undergrad, where you've got these multiple commitments and a lot of things kind of attract your attention away from study. So it's really important to have a good accountability relationship with our department. So when you do want to make a change to the program, you kind of disclose and share that, make sure that we're on your side, and we will be, and then we'll make sure that BCIT understands and it's reflected in your records. So at this point, you know, as a working health professional, just having a peer, a partner on your side to help with these things is super important, and we're happy to do that. It's actually part of our role in enabling student success. So feel free to reach out later to us and we'll make sure that things are aligned for you.
And questions come to mind that I recently came across from a student interested in your program, and perhaps somebody here would be interested as well. They had the academic requirements for the program, but they were from overseas, but they did fulfill them. And so they had no work experience here. So they were trying to figure out if they could sort of use the program to make a bridge into the industry, or should they find that work experience first in healthcare and then consider the program?
That's a great question, and it's not totally uncommon. My recommendation, and for those of you on the Zoom, you know, you might take this to heart as well. don't think in a kind of an either or sort of situation, or think of it as linear. I would suggest to think of it in parallel. So if you take certain courses like the ones that we designated for undeclared major, studying the Canadian health system, and use your role in the program as part of your job seeking process to say, look, I'm committing to my studies at BCIT, which everyone knows in British Columbia and at least on the West Coast, to demonstrate your investment and commitment to advancing yourself, plus gaining some new knowledge that you can use in your job searches, in your interviews, and having the literacy, the most current literacy around health policy and health leadership. So think of doing your career development and your studies in parallel, and that gives you more optimization around finding a fit that works for you, as well as sending a signal that you're definitely committed to advancement. Yeah, that's my suggestion. It's always better when there's uncertainty to think of placing really strategic bets rather than going for the big bang. And strategic bets is basically every course that you take, you'll be interacting with classmates, learning about what's happening in the health system, working with professionals in other areas throughout your studies, as well as thinking about healthcare, thinking about your role, and keeping that momentum going. So placing small strategic bets, and when you're ready, if you decide to commit to the program, then you can either commit to the program or lengthen the program to fit your needs.
So in other words, take any of the three courses or all of the three courses that are undeclared, that you can take as an undeclared student. And then at a certain point, you might be a better position to leverage those for a position in healthcare that you can use for your integrated project.
Yeah.
Would you say that would be right?
That's right. And one of the other critical milestones in this process and just managing the uncertainty is the actual integrated project that happens at the end. BCIT, this program being an online program and highly leveraged in terms of how we interact with the students and being virtual, we don't have a bucket full of projects that people can do with industry. People identify project opportunities with a sponsor through their own professional networks and through their own work experience and where they're situated in the organization. So over a 2-year period of study, probably many projects will come to mind because you'll be thinking about these in your assignments and in your discussions and in your coursework. Your employer might know that you're studying at BCIT. So there's many opportune ways for identifying good sponsors and topics. So by the time you get to the end of the program and it's time to do your capstone, you might already have a sponsor on your side. You may have kind of tested some ideas throughout your academic work earlier in the program, and then you're ready to focus on a project at the end. So the time of the 2-year period actually works in your favor to get aligned and ready for the final capstone. So for people who are kind of in between jobs or maybe changing from different parts of the health sector, time actually works in your favor if you're conscious and actually focusing on kind of closing that gap by the time you get to the end of the program. So that is one thing that you do have to kind of self-assess and use an informed judgment. I've seen many students really make that adaptation while they're in the program and leveraging the program to help them make that step as well. So once again, thinking kind of in parallel rather than either or do one first and then the other. They're actually going simultaneously. That was a bit of a long answer. Maybe Peter would appreciate that too. Any other questions? We have about 7 minutes until 7 o'clock, which is the end of our.
There's one more question in the chat about what each course involves.
What each course involves? You mean the topic area?
Does each course include writing various papers, research, self-reflection?
Yes. Yeah. So it varies. In the first course, the topic area for emerging health leaders, it's definitely not a quantitative course. It's not a highly theoretical course. There's a lot of self-reflection that occurs, journaling, for example, working in a small peer-to-peer group, not a big seminar sort of discussion. and not very long papers. So the first course is far more reflective than most courses that you might have encountered in your health sciences and health professions education that tend to be more clinical and critical, focused on health, health, safety, and care. Other courses in the program will be more quantitative in nature. So the project management course, for example, the financial sustainability course, but they're not quantitative in the way that you might have done like calculus back in the day. It's quantitative from a health leadership perspective. So understanding the concepts well enough and having the literacy to engage with colleagues, say, for example, engaging with the finance and the capital planning department in your institution. And they're the experts in that area, but as a health leader, you know how to engage and work with them, and linking that also to people-related issues and the overall direction of the organization, which is really the focus of the program, not to make you kind of learn the calculus and stuff that undergraduates would. Other courses are more policy and essay based. There's case studies involved. There are discussions using different sort of formats, a seminar style or a very simple answer the question sort of discussion. So there's quite a rich variety in the program, and it's all intentional, and it kind of builds up and has diverse ways of addressing and looking at issues. You've got about 5 more minutes. Any other questions that people want to ask? Or maybe I could summarize and just remind people of how to get in touch with us. Okay, so let's summarize. We've got about 3 minutes. So this is the contact information here for the department. You'll see that for healthcare management, this is the department at BCIT. It's based in the School of Health Sciences, and this is where we run the health leadership program. Our web address is listed there, and the email address is a shared inbox for the department that both Victoria, Denham, and I monitor. So if you have any questions, the best place for you to send it is to this address, where one of us will get back to you. As well, on our website, there is a get an assessment form. This is an informal way to share a little bit more about yourself and to get a quick response from us as to how the program might fit best for you. And in terms of getting additional support to kind of help guide you through the process if you do run into issues, Maninder and her team at Program Advising, they're well positioned for that. But I would say also at BCIT, we're pretty good at documenting everything for our program as well as processes. So make sure that you're familiar with the website. That's really the best first place to go. And we will be sending this PowerPoint deck to you after a few days later next week. And you can have a copy of that. And then we will be publishing this into our YouTube channel, and you can listen to the presentation again after we remove all the the personal discussions that happened during the Zoom. Just checking the chat to see if there's anything else. I think we've covered everything and all the questions that came up. So Victoria, do you want to do our close and then we'll close the meeting?
Sure. You covered some of the points, but just wanted to, we'll be sending you a copy of the slide presentation and a link to the video recording. And we'd just like to thank you for attending tonight. So have good luck with your future studies and have a great night.
All right. Thank you, everyone. Have a great night.